Morning class, my name is Tyler Ottersberg and today we're going to be talking about the different tools and equipment found in today's fire service. First, a few objectives. At the conclusion of this course, the student will be able to successfully identify and describe several different tools found in today's fire service. They will also be able to identify and describe the different types of personal protective equipment, or PPE, found in today's fire service. And finally, the students will be able to identify and describe when to use specific tools and equipment for different jobs in today's fire service. With that being said, let's jump into it. EMS in the fire service. Firefighters nationwide respond to not only fires, but also to medical calls. It is averaged nationwide that 90% of calls are medically related. Also, over the past 25 years, the number of fires in the United States has fallen by more than 40%. Here I have a few graphs showing just that. Our first graph here shows the amount of calls in the United States that are medically related. In 1985, there were roughly 6 million medical calls. 25 years later, that number jumped up to roughly 19 million medical calls. Over here, we have a graph showing the number of fires in the United States over the past 25 years. In 1985, there was roughly 2.3 million fires in the United States. 25 years later, in 2010, there was roughly 1.3 million fires in the United States. So what does that mean? It means that the medical calls will likely continue to rise, while the number of fires in America will continue to decrease. So, we need some kind of PPE to protect ourselves from these patients. Gloves, masks, eye protection, and gowns can all help prevent the transfer and spread of diseases through bodily fluids and airborne diseases. First, we have gloves. These gloves are just your typical latex disposable gloves. These should be thrown away after contact with every patient. Next, we have eye protection. This helps keep the user safe from bodily fluids from getting splashed in the user's eyes. We also have masks. Masks can be used by either the patient or the EMS provider. And finally, we have gowns. Now, you won't find gowns on every medical call. However, they are commonly used if there's a lot of blood involved, such as possibly childbirth or a high traumatic injury. So now that we have our PPE in place, we're going to talk about some different tools. A blood pressure cuff, a stethoscope, a wristwatch, and a notepad are all common tools firefighters use on medical calls. These tools allow firefighters to obtain vital signs from the patient. A blood pressure cuff obviously measures the patient's blood pressure. The cuff goes around the arm. The responder will then put in his stethoscope and listen for the heartbeats of the patient to determine the blood pressure. Next, we have a wristwatch. Wristwatches are used to determine the patient's the patient's heart rate per minute and breath per minute. Once the responder has this information, they're going to write it all down on a piece of notepad. The responders also sometimes put a piece of tape on their leg and will write Sharpie on there instead of a notepad. Either way, they need to be accurate so they can transfer this information to other EMTs or paramedics or even doctors at a hospital. Alright, now we're going to talk about one of my favorite topics in the fire service, and that is forcible entry. It's a lot of fun to do, and it's important to know how to do it the right way. A set of irons is used to make entry into many different types of doors. A set of irons include a flathead axe and a Halligan bar, as shown in the picture right here. It takes 2 firefighters to use a set of irons properly. One firefighter will use the flathead axe, the backside of it, to strike the Halligan bar, and the Halligan bar is used to pry open the doors. If a set of irons doesn't work, firefighters sometimes use a rotary saw, also known as a K-12 saw, as seen in this picture here. It only takes one firefighter to use the rotary saw, and there's also many different types of blades used that can cut through different types of materials. Alright, now we're going to talk about some of the structural firefighting PPE. The PPE that all firefighters wear to protect themselves include a self-contained breathing apparatus, or an SCBA, a helmet, a hood, a coat, pants, gloves, and boots. An SCBA, as seen in this top right picture over here, includes a face mask, an air pack, and an air bottle. Most air bottles these days run either 30 minutes or 45 minutes. The 45-minute bottles, however, can go as quick as 30 minutes under heavy workload that firefighters face. Next, we have a helmet. The helmet is hard-shelled to help keep the user's head safe from any falling debris or hot water. It also has a visor for extra eye protection and a neck guard here to protect the user's neck. Next we have a hood. The hood goes on under the helmet and under the coat and helps protect any exposed flesh area that the helmet or the coat doesn't protect. Next we're going to move on to the coat. The coat is 2 layers. It's mostly waterproof. It does a great job of keeping heat out. At the same time though, it does a great job of keeping the heat in. So it's important to regulate your body temperature to know what your body temperature is so you don't overheat and possibly pass out, becoming part of the emergency itself. Next we have our pants. The pants is made out of the same material as the coat, 2 layers, a couple side pockets for different tools. They also have suspenders. The suspenders obviously help keep the pants up so they don't fall down and possibly burn the lower back of the firefighters. Moving on, we have the gloves. The gloves are pretty much self-explanatory. They help protect the firefighter's hands. It's important to know how to do several different types of functions with these gloves on, since they will be on the majority of the time during a fire scene. And finally, we have our boots. This is a type of rubber boot. There's also type of leather boots that are out there. The boots help protect the feet of the firefighters from water, heat, and punctures. Alright, now we're going to move on to hazardous materials. This is an important subject to be familiar with, because if you go on scene to a hazardous material emergency and you don't know what's going on, there's a very good chance you could end up seriously injured. Hazardous materials, or hazmat. Alright, well, there are 4 different levels of PPE involving hazmat. Levels A, B, C, and D. Each suit is specifically designed to protect the firefighter in different life-threatening situations. First, we have our Level A suit. A Level A suit is vapor tight and should be used in the case of an unknown or unidentified chemical hazard emergency, or if the chemical hazard presents a high level of hazard. This suit is the highest level of user protection. The suit contains an SCBA and no vapors are allowed inside of the suit. Level B suits, as seen here. A Level B suit is liquid splash tight and should be used when the type and atmospheric concentrations of the substance have been identified and require a high level of respiratory protection but a less level of skin protection. Level B suits is well used in SCBA, however, vapors are allowed into the suit, yet liquids are not. Moving on to our Level C suit. A Level C suit is also liquid splash tight, but the suit does not contain an SCBA. Instead, the suit contains an air purifying respirator. The suit is used when atmosphere's oxygen levels are between 19.5% and 23.5% and the air contaminants have been identified. The only difference between a Level C suit and a Level B suit are Level B suits use SCBAs, Level C suits use air purifying respirators. Finally, we have our Level D suit. The Level D suit is simply a station uniform and provides no form of respiratory protection. This suit is the lowest level of user protection. Now that we have our PPE in place, we're going to need a couple different identification tools to help us identify how much and what type of chemicals we're dealing with. Some of the different identification tools firefighters use include pH paper, fluoride test paper, photo ionization detectors, and flame ionization detectors. Alright, so first our pH paper. pH paper is designed to change color when it comes into contact with corrosive materials. The color indicates the pH level. If the color of the test strip is between 1 and 6, it's an acid. If it comes back between 7 and 12, it's a base. Next are fluoride test paper. Fluoride test papers can be used to determine the presence of fluoride ions in gaseous hydrogen fluoride. The pinkish red paper turns a yellowish white in the presence of fluorides. These work very similar to the pH paper. Instead of checking for acids and bases, we're instead checking for fluorides. Next, we're going to get into our photoionization detectors, as seen here. Photoionization detectors, or PIDs, use an ultraviolet lamp to ionize samples of gaseous materials. They are used to detect low to very low concentrations of many organic and some inorganic gases and vapors. Finally, we have a flame ionization detector, or a FID. These FIDs are used when relatively small concentrations of contaminants are known or suspected. Calibrated to methane gas, they have a detection range from 1 to 10,000 parts per million for methane and 0.2 to 1,000 parts per million for other materials. Alright, in summary, the modern firefighter responds to medically related calls far more than any other type of call. Some of the PPE that firefighters use on a medical call include gloves, masks, eye protection, and gowns. Some of the tools used by firefighters on a medical call include a blood pressure cuff, a stethoscope, a wristwatch, and a notepad. A few tools involved with forcible entry include a flathead axe and a Halligan bar, known as a set of irons, and a power saw such as a K-12 saw. Firefighter PPE includes a self-contained breathing apparatus, or an SCBA, a helmet, a hood, coat, pants, gloves, and boots. The 4 levels of PPE involved with hazmat include levels A, B, C, and D. And finally, a few different hazmat identification tools are pH paper, fluoride test paper, photoionization detectors, known as PIDs, and flame ionization detectors, known as FIDs. Well, that's it. I hope you all enjoyed and have learned several new things from today's lesson. Thank you for joining me, and I hope to see you all again soon. Thanks and take care.